Hello there. Hi everyone. I'm Randy Murphy. Hopefully we're Facebook Live today at 2:30. We had a little technical difficulty last week, but I think we've gotten it straightened out thanks to Mark. I'm Randy Murphy. Hopefully we're Facebook Maybe Live not. Today at 2:30. All right. Are we ready? Okay. So I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Seems like I'm a little bit low. Okay. Here to give you the Monday, January 4th Facebook Live update on the impact of the COVID-19 pandemic on Mobile County. Happy New Year, everyone. I hope you had a safe and restful holiday and are looking forward to a bright, shiny new year. So worldwide, we have had more than 85 million cases of COVID-19. In the United States, we surpassed 20 million cases of COVID since we last spoke. Alabama has almost 375,000 cases. For deaths worldwide, just over 1.8 million, over 350,000 in the United States alone. That is by far the most of any country. And in Alabama today, 4,878 COVID-19 deaths. So our data on Mobile County residents today, we're reporting on 26,994 cases of COVID-19 reported to us. Yesterday, 156 cases were added. That's a really large number for a Sunday, as you guys have learned. Usually our numbers drop off, particularly on Sunday, due to clinic and lab closures. We have been averaging far greater than 200 cases daily the last week alone, averaging nearly 250 cases per day. Again, those are the numbers that we haven't seen since late July, when we experienced our first wave of the COVID-19 pandemic in Mobile County. We have 512 who have died with COVID. 2 were added yesterday. Cumulative number of people hospitalized in Mobile hospitals with COVID-19 stands at 3,380. That was an increase of 31 over yesterday. And the most troubling number, talked to lots of media last week, the number of hospitalizations has continued to increase. Yesterday, our hospitals reported that 214 people were in the hospital with a COVID-19 diagnosis. That exceeds our previous record of 210 on any given day. We had one day in late July and one day the first day or two of August with 210 hospitalized on any given day. So we have far exceeded our peak number of hospitalizations, so 214 yesterday. We know that our hospitals are doing their best to keep up with demand. They're expanding services where they need to, but again, we as community members need to do our part to try to slow the spread of COVID transmission as not to further overwhelm the hospitals. So we released our weekly expanded report today, we provide a lot more detail in that report. It comes from several different data sources, which is why it takes us a little bit more effort to compile it. And I've continue to get some questions about it, and I'll try to address one or two as we go along. So if we look at the number of cases reported by week, last week there were 1,731 reported to us during the week ending January 2nd. That's by report date. If we look at that by the date that the patient was infectious, of course, that number is much lower. So let me talk a little bit about how infectious date is calculated. So it attempts to estimate the time at which a patient was most likely infectious, not the date it was reported to us, which, as you know, can be days or weeks after the patient has COVID. So the way we calculate this is, first, we take the illness onset date if we know it. You know, there are lots of people who are not, they don't have illness, so we don't have an illness onset date for them. We also don't have illness onset date for people that we cannot contact to interview. So first, date of illness onset. If that's not available, the date of specimen collection. And if that is unavailable, then we use the date it was reported to public health. So as you know, that obtaining specimen collection date, obtaining illness onset date sometimes takes some time to gather. The report date comes across instantaneously when the lab report comes to us, or when a physician or a nurse or a facility or reports it to ADPH. So there will always be the number of reported, which has nothing to do with illness, is the way we've been traditionally counting since the beginning. But when we then look at it by that infectious date, then it backs up the date in the epicurve. So if you look at our expanded report, for example, someone was asking specifically about the 20th of December, where if you look at date of report, there were 1,517 cases reported. But if we look at infectious date or infectious week, the number was much lower of 432. But what happens is then the count for weeks months ago then increase a great deal. So let's say if we look at this week's report, even though there is a big difference between report date and infectious date that we're looking at just for the past couple of weeks, if you go back and look, let's say in July, the number reported the week of July 5th reported was 817, but the number infectious on that date was 1,563. So what happens is when we get those reports and we're able to calculate an infectious date, then they are placed in the epicurve in the weeks and months prior to what we're currently looking at, and that's why the current weeks or the past few weeks numbers look so different. Okay. There may only be one person who is interested in learning more about that, so I won't lose the rest of you by getting any more detail than that. So just want to emphasize that we are still seeing widespread community transmission. We are in an accelerated phase of our outbreak. The number of cases is going up. The number of hospitalizations is as high as it has ever been, a record-breaking day, and the number of deaths is increasing, albeit at a slower rate than we have seen previously, presumably due to fewer outbreaks in nursing homes and the availability of treatments that reduce the severity of illness and reduce deaths. We're going to continue to keep an eye on that because it is inching up. Again, highest rates and highest counts in the younger populations, 25 to 64, our level of emergency department visits for COVID-like illness is going up. Our percent positive, so the number of positive tests among all COVID tests is going up. In Mobile County last week, it was up to 18%, which again, that is the highest it has been since the middle of July. And we are just now past the holidays. So we did see a large increase in transmission in the number of cases following the Thanksgiving holiday due to household gatherings, family gatherings, social events, and it will be at least 14 days before we see the peak of transmission following the Christmas holiday, other religious holidays, and New Year's Eve and New Year's Day. So we will skip over the school report because schools are still out. So we will pick that back up as schools go back into session. And just talking about the locations, I think last week or last Monday when we spoke, there were only 3 zip codes that I focused on to make sure you were hearing me about where you have high transmission, and this week we have many more. So we are still seeing a hot spot of COVID transmission in the Satsuma, Saraland, and now Creola areas. So definitely some of the highest rates of transmission in our county are occurring there. Last week we saw in Sims, pop up into one of our higher categories. So Sims, Alabama is now a hotspot for transmission, zip code 36572. Irvington and the Bayou still on our red list. This week we added Tillman's Corner 3667093, I think 93, as a hot spot. And then one more urban zip code 36607, which I believe is there at Spring Hill and I-65 in the North and South Crichton area. So those are your geographical hot spots. Again, it's bad everywhere, but it's worse in those locations when we look at things per capita. So a couple other things we report on, the number of complaints. So let me just talk a little bit about that. So we are continuing to receive complaints about retailers, businesses, restaurants that aren't adhering to the Safer at Home order, to the mask mandate, that aren't enforcing physical distancing. And last week was no different. So we're hearing about big box stores, wholesale stores, social clubs, big businesses, small businesses, daycares, restaurants, drive-thrus, gas stations, other more sort of spots that people go to get outdoors. We know there are a lot of people looking at Christmas lights outside over the holidays. We got a lot of reports from those types of activities. And again, just, really the only thing public health can do is what we're doing, is to try to call and inform and educate. The mask mandate, the Safer at Home order, is only enforceable by law enforcement, and so far that's not been a focus of their activities. So please be patient with us. We get complaints. We have several locations around town that we get complaint after complaint after complaint. So at some point, calling them and trying to educate them is really just frustrating them and us. So we will continue to work with those that we can help educate, and those that now 10, 11 months into this event are obviously not going to change their behaviors. We probably will give up on trying to use education to try to get them into compliance, and we'll consider other avenues. So let's see. We have 11 nursing homes with outbreaks. We have 3 assisted living locations with outbreaks. We're very thrilled to hear that many of them started receiving vaccine last week. That is just such a great shot in the arm. Get it? So shot in the arm that we got vaccinated. Thanks, Mark. Thought you would appreciate that. Our investigators are just covered up in the number of cases. We have, like I say, all systems overwhelmed with such a high number of cases being reported to us at this time. Okay, so let me answer some questions. So yes, I have some FAQs here that we've had to supply to the folks that answer the phone, because we're getting so many questions from people who want to know, when is it going to be their time to get vaccinated and how will they know that? And, there are no lists. There are no registries. We only know right now that we are vaccinating in the 1A priority. That's all we know, and that is frontline healthcare workers, including clinical and non-clinical staff in hospitals, nursing homes, or those providing in-home or mental health care directly, workers in healthcare services, such as those providing transportation and environmental services, and those in mortuary services, first responders. So the guidance that we received from the Alabama Department of Public Health was that you shall vaccinate 50%, use 50% of your vaccine to vaccinate people in healthcare settings, use 15% to vaccinate physicians, so licensed providers, 15% EMS, and then 15% of our allocation was skimmed off the top for nursing homes. And that's being distributed through CVS and Walgreens. So that's what we were told to do, and that's what we did with our 500 doses, and they are gone. We know we will get 500 for the second shot in arms, so if you got a first dose from us, don't worry, yours are safe, but we have no information when we might receive additional allotments of vaccine. The health department received Moderna. There is a website. The Medical Association for the State of Alabama has a public website where licensed providers can go, and there is a list of hospitals around the state that are providing vaccine as directed by the state health department to those 1A priority groups. So again, Medical Association of the State of Alabama, if you are a licensed healthcare provider or think you fall in one of those 1A priority groups. But beyond that, we have no idea when it's going to be your time to take the vaccine. Please monitor vaccinefinder.org. I realize that right now there is no COVID vaccine option on that website, but that is where you will go eventually to identify locations that have public, distribution of COVID vaccine to the available priority groups. So covidfinder.org. We don't know when other groups are going to be vaccinated, including those that are 75 and older or who have underlying medical conditions. So please, there's no need to call us because we don't know and we don't have a list. We don't have a registry. I have a bunch of emails in my box and in my inbox and voicemails on my phone, people calling to ask me about this, and none of us know the answer to this question. So I've gotten questions from the media about, how many vaccines were allotted to Mobile County and how many have given it out and why is the rollout slow, and what have we been hearing about what's causing some slow rollout, and what's this going to look like going forward. So the state of Alabama last week published a dashboard showing the number of vaccines that had been allocated in Alabama and the number that had been administered. And that number has not been updated since December 28th. So on December 28th, the state announced that there had been just over 128,000 vaccines allotted in Alabama, distributed and targeted toward those groups, hospitals, EMS, and providers. On the 28th, only 20,000 of those doses had been administered and had been entered into the statewide immunization registry called Imprint. So again, part of it is that it's not been updated since the 28th. It will be updated weekly, I'm told. So expect that to change dramatically. It's been somewhat slow because it happened the week of Christmas and the couple of weeks before Christmas. So the vaccine became available during the holidays, during winter, also during, what in Alabama is going to end up being our current worst time in the pandemic. So, we have staff shortages because of COVID. So it's just, there are a lot of reasons why it has appeared slow. The health department, we did everything we could. I think we wore out many employees trying to give our small number of doses into the arms that we thought needed them most. And again, I think part of it is the holidays. Part of it is a data lag. I think part of it is uptake. A lot of people are saying, I'm not going to take it this round. I'll wait till the next round. Well, we don't know when the next round's going to be. So my advice is if you're offered vaccine, take it when you can get it, because we are never promised another day. And then also just remember that, Operation Warp Speed was the federal campaign to get vaccine produced and rolling as quickly as possible. Many billions and billions of dollars went to vaccine manufacturers. That same level of preparation and funding, has not really happened at the state level. We don't have systems, for rostering people. We don't have appointment systems. We don't have hundreds of people to hire to do this right away. And so we're having to do it under, in the capacity that we have. We're working towards hiring more staff. Spoke to a couple folks in the news about that last week. We're trying to get systems in place to maybe automate appointments and reminders. But right now, we're trying to do our patient care. We're trying to do all of our case investigation. We're trying to test as many people as we can. And adding on that other layer of vaccinating is going to take some time. People have kind of given us a hard time for why is the health department just focusing on testing all the time? You should be vaccinating. Well, we only had 500 doses. It can only go so far. When the outbreak first started last March, April, May, we couldn't test. We didn't have testing available. Now we have testing. And so we try to provide things to you that are available to us that we can support and maintain. And we're doing our best to try to get things in place so that as more and more vaccine becomes available, we can get it out to you. Right now, there is a shortage. We're already sort of in a supply shortage when it comes to COVID vaccine. So we have no idea when allotments will be made to Mobile County beyond what has already been allotted. Okay, let's see. A couple more FAQs here. And again, around questions about when will the vaccine be available to the public? Will there be a sign-up list? They will be available to the public. It's likely going to be March or April at the earliest. There's no sign-up list at this point. We're still working out all those operational aspects. Let's see, are there any other medical facilities giving vaccine? So hospitals, a few pharmacies, and are providing vaccine, but they have provided, been told how to distribute those vaccines, and that's how they are doing it. Everyone in Alabama right now is in phase 1A. When we are told we will get more vaccine and we can move to include phase 1A and phase 1B, we will let you know. Someone asking, will Mchd administer vaccine to other healthcare workers? Yes, we did that with our first round. We were very happy to reach out to some of our, community health center partners and a few other agencies to offer a small number of doses to their highest risk healthcare workers. Let's see, we're not taking appointments to get vaccinated. There is no list. Sorry, I know March and April doesn't sound soon enough for everybody, but that's the best we can do right now. Someone asking about the time frame. CDC went back and revised their guidance for, the age range for vaccination, and it is now 75 and older, and that's due to projected limitation of the vaccine availability. So again, we don't have an unlimited supply. Let's see. Someone asking that, we've heard lots of rumors about other counties that are vaccinating the public. That's not true. If it is, it is not widespread departure from the guidance. Everyone in the state that has been provided vaccine at this point agrees that we are going to stay in the same phase together and move through it as a community so that we don't create competition for vaccine and have people driving to other counties because they heard that, people over the age of 75 could get it. So let's see someone asking about are handheld UV lights effective in removing germs from hard surfaces? So some UV lights, when they are in contact with surfaces for a specific length of time, do kill germs on surfaces, but do not be fooled by scams and too good to be true deals on TV and that sort of thing. So do your homework. If you're thinking about purchasing a UV light. Other vaccine questions about when can healthcare worker families get vaccinated? I don't know. I'm so sorry I can't answer it any better than that, but I just don't know. Okay. Anything, Mark?
You want to just get the next.
So So I only see 2 on there because of the delay, I think. Okay. So someone asking, why is the last weekly report only 5 to 6 days? I'm not sure what that is referring to. Because the weekly report goes through Saturday, July 2nd. January 2nd. Yeah, it goes through January 2nd. And then someone asking about the new variant. So you've probably heard there are, variants. There have been a few variants of the SARS-CoV-2 virus identified. The most notable one in the UK and now one that has emerged that's very similar from, I believe, I don't know, another continent. Another continent. I just heard it on the CDC call a few minutes ago. So far, the take-home messages for the new variants is that yes, they've already been identified in 3 states in the U.S. They likely have been here for some time. So far, the worst bad thing about them is that they are more highly transmissible, so they're more infectious. So, whereas, one person with regular SARS-CoV may infect 10% of the people that he or she comes in contact with, for the new variant, it'll be 15%. So 50% or so more infectious than the normal SARS-CoV-2. So far, it doesn't look like there are any big clinical differences, so it's not, more or less severe illness. It doesn't affect ages or older or underlying conditions any differently. There is at least one testing platform that seems to identify, there's some consideration for using that platform for the new variant, but for the rest of them, it's looking like it's okay, that we're not going to have to, recreate every wheel when it comes to testing for this new variant. And then also, I think that the natural immunity that develops from one variant is still protective on the others. So again, those are very, very early pieces of information. And like I said, almost every day in the spring, as we know more, we will let you know. Things are changing every day, so please be patient with us as we try to learn the epidemiologic and clinical impact of this new variant. Okay.
The top one.
I tested positive on December 11th. No one from a health care organization contacted me. So a couple of things might have resulted in you not receiving a call from public health after you tested positive for COVID-19. One is antibody tests are not reportable. So if it was an antibody test, we wouldn't hear about it because that's really not an appropriate test for infection. If it was an antigen test, it's likely we may not have heard about it because there are lots of urgent care or rapid testing locations that are conducting rapid antigen tests, and not all of those get reported to public health. That might be another reason. Also, if you don't fall into a priority group for testing, we probably did not call you. So right now we have so many hundreds of cases being reported every day. We're not able to contact everyone in a timely manner that might make it beneficial to do so, right? I mean, once your test result is, 5, 7, 10 days old, us talking to you to conduct an investigation really has very little value because you've already exposed or already infected people before we get you on the telephone to remind you that you're supposed to stay at home. So when systems get overwhelmed like they are now and we're not able to contact everyone, we prioritize very young children, pregnant women, we investigate deaths, we try to make sure we investigate illness in those that are, are among our oldest populations. So if you're, let's say, between the ages of, 18 and 65, and you got COVID a couple of days ago and you didn't receive a call from us, it's also likely that we did not prioritize your case for investigation because our resources are limited and we just cannot get to all the thousands of cases that are reported every week. So with that, I'm getting the thumbs up from my colleague Mark here. So I will end today's update and we will talk to you again on Friday. Have a great week, everyone.